Hello, friends. Today, our topic is Alzheimer's disease and medication for Alzheimer's disease. So, let's start with question 1. All the below mentioned drugs are choline esterase inhibitors except galantamine, memantine, tacrine, and rivastigmine. So, as we know, in Alzheimer's disease, there is deficiency of acetylcholine, and we have to give such medication which will prevent degradation of acetylcholine. So choline esterase is one enzyme which causes degradation of acetylcholine. So if we will give choline esterase inhibitors, it will prevent the degradation of acetylcholine, and thereby increase in acetylcholine can be a treatment for Alzheimer's disease. So galantamine, tacrine, and rivastigmine, these are all choline esterase inhibitors. Memantine is acting on N-methyl D-aspartate receptors. It's basically antagonist for this receptor, and it prevents the excitotoxicity caused by glutamate. So memantine is not cholinesterase inhibitor, it is N-methyl D-aspartate receptor antagonist. So memantine is the correct option out of these all four. So next question is regarding choline esterase inhibitor, which is hepatotoxic and is not preferred. Is it rivastigmine, tacrine, galantamine, donepezil? All of these medicines are choline esterase inhibitors, but we have to choose the drug which is hepatotoxic out of these. So tacrine is the choline esterase inhibitor which is hepatotoxic. Basically, it acts centrally, and it enhances cholinergic transmission in the brain. It is short acting, but it's having various other side effects also, like nausea, abdominal cramps, diarrhea, and hepatotoxicity also. That's why newer agents like rivastigmine, donepezil, galantamine are preferred, because they have fewer side effects. Next question is about N-methyl D-aspartate receptor antagonist, which acts by blocking glutamate-induced excitotoxicity. Is it rivastigmine, tacrine, galantamine, or memantine? So as we know, rivastigmine, tacrine, and galantamine, they act by inhibiting choline esterase, thereby preventing degradation of acetylcholine. So correct option is memantine. So memantine is N-methyl D-aspartate receptor antagonist, and it's found to be effective in patients with moderate to severe Alzheimer's disease. It acts by blocking glutamate-induced excitotoxicity, and its side effects are mild and reversible, like it can cause headache and dizziness. And it's started with 5 milligrams once daily, and we can increase to 10 milligrams 2 times daily. Alzheimer's disease is a progressive neurodegenerative disorder due to loss of dopaminergic neurons, cholinergic neurons, serotonergic neurons, or all the above options are correct. So Alzheimer's disease is neurodegenerative disorder characterized by progressive impairment of memory and cognitive functions, and a patient can have other symptoms also, like depression, anxiety, or disturbance in sleep. Mainly cholinergic neurons are affected, and there is deposition of senile plaques with neurofibrillate tangles in the brain. And this slide is showing healthy brain and shrunken brain with Alzheimer's disease, and it's showing comparison between healthy neuron and dying neuron with deposition of these amyloid plaques. An extract of Chinese plant acting as platelet activating factor antagonist, used as an cognition enhancer, used in dementia, tinnitus. Is it piracetam, eniracetam, or is it ginkgo biloba or tacrine? So correct answer for this question is ginkgo biloba. This drug is obtained from Chinese plant. It's having medicinal use. It acts as anti-inflammatory drug, and that's why it's used in inflammatory bowel disease, in arthritis, in cancer patients. It's also having antioxidant action, and it also improves circulation by inhibition of platelet aggregation, and it's having a role in stroke patients, in tinnitus, And in Alzheimer's disease, it plays a great role by improving memory and brain function. That's all for today. Thank you.